Okay, I think that we're in here. Let's see, it's, oh, I see some folks. Let me see. I see 5 participants. It looks like people are popping on, but I don't see names. How about you, Doreen?
I just see us. I don't see them. Oh, wait, hold on. Yes, I do. Go to attendees instead of panelists.
Let's see. I see Doris. Hello, Doris. I see Maria Inserra. I see Dana Walker-Boyd. Hello there. We're just going to give folks a couple minutes, 2 or 3 minutes to get on here, and at 2:05 on the nose, we will be hitting start. I'm going to try, for those of you, this is so strange not seeing everyone, but I'm going to just try a message in the chat function. And see if that worked. If anybody received that, give me a yes in the chat. Oh, there we go. Hello, Doris, to all panelists and SIEDC. We just got Teresa Marola. Thanks for joining us, Teresa. We're just giving 2 more minutes and then we're going to start.
We're on broadcast right now?
We are, and we're recording for posterity. I'm hoping that the dog doesn't bark.
Do you see the DMI in the back?
Actually, your head's in the middle of your DMI. There, oh, there I saw it. A little more that way. There you go. Perfect. Hello, Doreen Cunho. Nice to see you, or not see you. I see your name, but I don't see you. It's kind of a strange thing. So we're going to go ahead and get started because I know that people have been Zooming like crazy today, and I don't want people sitting around here waiting for nothing. I know most of you who are on here. I'm Gina Gutman. I'm the Senior Vice President for the SIEDC. And today at our Women in Focus session, we're going to be focusing on 2 different areas, one sort of the health of your business and one of that for your personal health. So our first speaker is going to be, oh, there she is. There's our first speaker. Hi. She just joined.
Hi, sorry for my lateness. Hello.
So our first speaker today is going to be Dr. Fiona Shehaj. Did I say that right?
Yes,
I think I did. Very good. She is a certified in internal medicine and has completed her fellowship in cardiovascular disease. She specializes particularly in women's heart health. So as you all know, this is a combination of our business conference and our health and wellness expo. So we are trying to do a business topic as well as a health and wellness topic in one session. Generally, this is a session for our Executive Women's Council, and I see people joining as we speak. So thank you and welcome. Hello, Carol. Nice to see you, or see your name, not your face. But we are going to get started right away. And what we're going to do is Dr. Fiona is going to speak for a little bit on heart health, and then she'll do a Q&A because we do want to be able to let her go and treat some more of her patients. So she's going to do her session and then take her Q&As. And then afterwards, we'll be joined by Doreen Inserra, who you probably see, I think, on the top of your screen. from Doreen Inserra CPA. She's the president and owner of her own firm since 1997. She's won a Lou Miller Award from the Chamber of Commerce. She's also a past president of the New York State Society of CPAs and has a wealth of knowledge on all topics CPA related. So I'm going to pass it over to Dr. Fiona, and I'm going to mute myself. So if you hear me talking or something like that, just raise a flag or send us a message in the chat.
Sure.
Thank you.
Thank you so much. Appreciate it. So as we already know, my name is Dr. Fiona Shehaj. I'm a cardiologist, and I'm currently working at a Richmond University Medical Center. I also go through 3 different offices around Staten Island, so I'm pretty much available at any location throughout Staten Island, North Shore and South Shore included. My specialty is mostly preventative cardiology, and where that entails is pretty much hopefully trying to keep you as healthy as possible before I pass you on to my partners who are interventional cardiologists. One of my specialties is also women's health, and that I really take to heart, and I really is one of my passions pretty much. Throughout my studies in medicine so far, I've noticed that women especially are the group of patients that are not, as doted upon as other patients would be. So I just want to give you a little bit of a background in cardiovascular disease and women's health. Essentially, cardiovascular disease in women is actually pretty serious. Cardiovascular disease accounts for about 1 in 3 total deaths in women per year. When we think about women's health, we always tend to think about, let's say, breast cancer as being one of the more serious conditions and that affects women. Well, in fact, one woman dies in about 1 per minute due to heart disease. So heart disease is much more prevalent, it's much more serious, and it tends to affect women at an alarming rate. Basically, women die of heart disease and heart disease related issues much more than all cancers combined. So that is an alarming rate and something that we need to really tackle. We also think about heart disease as a men's disease, but that couldn't be any more false. Essentially, the past couple of decades, since the 80s, women have started to actually catch up when it comes to men and heart disease. Women die at an alarmingly higher rate of heart disease than men do, especially in the past couple of decades as well. And we ask ourselves, why is that? Why is it that women are dying much more and much faster rate from the past few decades as opposed to men? And that's because a lot of heart disease and a lot of research done in heart disease is based on men and studies done on men. So these research where we find out that basically, for example, when it comes to heart attacks and how we handle heart attacks, all the studies that show that, left-sided chest pain and jaw pain and arm pain, that's mostly due to the presentation that men would come in for. Women tend to present in more subtle and vague ways. Women tend to present with fatigue and lightheadedness and nausea, vomiting, the feeling of anxiety or palpitations where your heart is beating out of control. So when we look at those symptoms, when we see those symptoms, those symptoms are very vague. Those symptoms are things that can pertain to other diseases and other issues as well, or sometimes can even be disregarded as anxiety attack or panic attack, whereas this woman could potentially be having a serious heart condition. So now we are recognizing the differences in how men and women present. So now we're paying more attention to the symptoms of women and how they would present in our daily office visits. So that's where my job comes in, is basically to build a rapport with the patient, to build a rapport with women specifically, and to pay attention to their symptoms and how they differ and how they feel themselves. So the biggest person, the biggest advocate for women's health is actually women themselves. They know themselves better than anybody else. They know themselves better than I would know them from a visit to visit basis. So it becomes almost like a team effort where they tell me about their changes and what's going on. And then it becomes my job to pay attention to their needs and pay attention to their symptoms and actually do the research and the background and the investigative work into what's going on and why they feel the way that they do. So it's very important that we do start recognizing these very subtle differences in women's health and how they pertain to each woman and their overall health and wellness. But I do want women to know that, and this is something that I preach on a daily basis in my patients, and also when I do any sort of talk, is that 80% of heart disease is preventative. 80% of heart disease is something that we can change. Whereas 20% has to do with things that we cannot, such as genetics and family history. 80% is something that we have control over. What does that mean? That means with lifestyle. Lifestyle is very big when it comes to heart disease. Quitting smoking, healthier eating habits, being able to exercise, even about 30 minutes of walking a day, a few times a week, that adds up. Taking the elevator, taking the dog for a long walk. These are things that not only will decrease our chances for heart disease, but also bring joy into our lives if we're able to do something that takes our mind off of things, off of our stressful lives. And then also the traditional risk factors are also something very important, and something to be handled with your primary care physician or the specialist that you're dealing with. And that is the big trio, which is diabetes, high blood pressure, hypertension, and also high cholesterol. Those are something that women should potentially have checked every 6 months at least. Get screening for high cholesterol, get screening for high blood pressure. So that is something very, very important. Now we have medications to obviously handle all these diseases, handle all these issues. So it's very, very important to formulate a plan with your healthcare providers in how to lower your risks of heart disease. Heart disease, like I said, is 80% preventable, but once you reach a point where you do have heart disease, there's also many, many different medications and changes that we can make to help patients basically live healthier and longer lives. And then there's the 20% of issues that we basically tend to, not be able to change, and that's family history or history of preeclampsia during pregnancy, early menstrual cycles. Those are some risk factors that unfortunately are out of our control, but still there's something that we can discuss with our patients, that we can discuss with your healthcare providers in order to make some changes and live healthier lives. So it's important, aside from taking medications, aside from talking to your healthcare providers, that we have these kind of panels and meetings in order for us to be able to spread knowledge and spread awareness in how we can take a handle in heart disease, especially. So besides that, I'd like to open it to you guys if you have any sort of questions to ask, and I'll try my best to answer.
So if anybody would like to go into the Zoom chat and ask a question, I will start with one just to get us started. Just wondering, Dr. Fiona, when you have high cholesterol levels and
Yes.
what the connection is in that. It could be something that comes on that you've never had a problem with and then you do. What is the exercise I know is supposed to do that? What are the things you can do? Because I know that impacts heart health.
Absolutely. So I'll start by explaining that, with cholesterol, there's three main components that we look at when we look at cholesterol and how we measure cholesterol. The total number is not, although it's something that we do look at, it's not the most important thing. There's three components to cholesterol. There's the HDL, which is the good protective cholesterol. There's the triglycerides, which come on more if, let's say, you eat a high volume of fatty foods and high carbohydrates, dense foods. And then there's also the LDL. That's the gunky stuff that tends to get into our arteries and cause the issues and cause the blockages and plaques over a longer period of time. Through exercise, we're able to raise the HDL. And studies have shown that higher HDL, relatively speaking to the LDL, the bad cholesterol, HDL is able to actually kind of go in there into our arteries and try to clean out some of this messy plaque. So that's why exercise not only helps for cardiovascular health, but it's also helpful in increasing our HDL, in us being able to fight off some of this bad cholesterol. The triglycerides, that's mostly diet related. So that's something that we can bring down through eating a little bit healthier. Fruits, vegetables, foods high in fiber also are a good component in bringing down our triglycerides. And the LDL, as we get older, unfortunately, or sometimes even just genetically speaking, the LDL can kind of creep up. Even though we eat healthy, we exercise, we do all the right things, we do have patients where we notice that the LDL is not where we want it to be. 100 is that number. So we want the LDL to be less than 100 in order for us to be considered at a healthy level of cholesterol. And unfortunately, even though the patient does their best to lower this LDL, sometimes we need the little push through medications in order to bring this number down. So basically, overall, it's almost it's a team effort essentially, through exercise, through dietary changes, and sometimes, unfortunately, we do need the medications to bring it all together and be able to lower the cholesterol.
Okay, so if someone has a cholesterol problem, then it's not a situation, if you've never had it before, that you have to worry that you're having a heart attack tomorrow. You know, it's not
Exactly.
like
No.
it's just something that you need to then proactively try and address.
Exactly. Usually what we do is, if let's say we discover high cholesterol in a patient that's never had high cholesterol before, we formulate a plan of lifestyle changes first. If let's say after about 3 to 6 months, if the cholesterol is still not where we want it to be, that's where we start thinking about medications, because we notice over a period of about 5 to 10 years, if you leave the cholesterol unchecked, that's when the issues start arising. So like you said, it's not something that tends to happen overnight, but it does tend to happen through a longer period of time, where the cholesterol kind of builds up in our arteries and causes the issues.
Okay, great. Thank you very much. Do we have any
course.
other questions? We have the chat open. I don't see any other questions. I'm surprised, because I've
That's
got
okay.
lots, but I don't want to monopolize the conversation. I'll
That's
have to come
okay.
see you separately, Dr. Fiona.
Not a problem. I'm here.
Anyone else? If no one has another question, oh, Doreen does. You got to unmute, Doreen.
There I am. Hi, Dr. Fiona.
Hi, Doreen. How are you?
The cardiomobile device, what's your opinion about that? Do you ever see it on TV where they say that you test your rhythms and your AFib and all that stuff, and you do it at home? Is
Sure.
it worth it?
So with the rise of technology and the rise of like Apple Watches and, like you mentioned, the cardiomobile, they're on the rise now. And I wouldn't say that, you know, they're a bad thing or they're something that we should shun, but it's something to be taken with a grain of salt. A lot of these machinery, they don't tend to sit properly, let's say, on the wearer, and sometimes they're based on movement and artifact. So more than a lot of the times, they'll give patients anxiety about, you know, something looking kind of erratic and abnormal when they actually feel fine themselves. So I would tell patients that if you do have a device such as anything mobile, that bring it on to the office and let's review it together, so I can actually help explain to you exactly what's going on. I don't think that these mobile devices should take the place of a provider, but I think that we can actually bring it into the plan of action and be able to explain to the patient what's going on based on what they see on these devices.
Okay.
Thank you.
Well, any last words for us, Dr. Fiona? Any kind of, pep talk for us on heart health? Any last minute takeaways before we let you get back to treating folks?
Sure, not a problem. Well, the good news is that although heart disease, it is unfortunately the number one cause for mortality and morbidity in the United States, especially with awareness, we're actually becoming more cognizant of the problems and how we're able to change. So we're doing a good thing here, and something that we should be patient on the changes that we will be seeing in the near future. That although it is pretty serious, we are making the right changes and the right steps into getting healthier. And with that, we're also noticing changes in our studies and our research opportunities. Now we're including more women in the studies. So now we're taking women's health more serious, and we're being more inclusive into health of everyone, not just men or different ethnicities or different populations. Now we're taking into account everyone. So that's very, very promising. And I'm sure in hopefully about 20, 30 years, we won't be having this conversation. We'll be, having a different type of conversation and how much we've improved in the past decades. But until then, I'm very hopeful.
Very good. Thank you so much, Dr. Fiona, for your time and for those important tips for us, for the women in the group. So be safe, and thank you again for everything.
Thank you so much, everyone. I appreciate you having me. I appreciate it. Thank you.
Enjoy your afternoon.
Thank you. Take care.
All right. Thank you. Ladies, we're going to move on now to Doreen and Sarah. As I mentioned, this is both a health and wellness expo as well as a business conference. And Doreen and Sarah, as I mentioned, CPA, a member of our Women's Council, is going to be discussing the New York State SHIELD Act. So I will turn it over to her.
Thank you, Gina. So we're going to go over your business and the New York State SHIELD Act. And as you know, my name is Doreen Inserra. I'm a CPA, also a certified government financial manager, and I have a cybersecurity advisory services certificate. So that's why we're going to talk about cybersecurity and the Stop Hacks and Improve Electronic Data Security for your business. You want to protect your business. We're going to go over the Small Business Guide for Cybersecurity in New York State. And data is an asset in your business. So I always like to look at what's going on in the news. The Journal of Accountancy, since I'm an accountant, does a lot of analysis of numbers. And what they found was cybersecurity breaches are totaling and costing around the world $1.5 trillion annually. That means your business for one record could cost $150 per record if you have a breach. And the average amount of records in a breach is about 25,575 records. That could bring your business down. So what you want to think about doing first is strategic pruning. Delete those old irrelevant data files, follow your retention policy. We're going to talk about some more internal controls, but since we talked about the healthcare area, in the latter part of October, the FBI and 2 federal agencies has credible information of an increased and imminent cyber threat to US hospitals. And that's very important to be aware of. In Europe, in Germany, a patient was routed to the improper location because of an IT glitch and a breach. Doctors had to do record keeping on paper and pencil instead of doing the electronic lab reports. So this could affect systems largely. The bad guys and the bad gals smell the weaknesses in your system. What happened was Equifax had a breach in July of 2017. They made a settlement with the New York State Attorney General's office of $19.2 million. And part of that was credit monitoring, but they didn't realize how big of a magnitude it was of information that was released. So 2 cybersecurity bills came out in New York State. The New York State SHIELD Act, which we have to be concerned about with as businesses, for residents that we serve in New York State. The business doesn't have to be in New York State. You could be outside of New York State. Also, there's the Identity Theft Prevention and Mitigation Services Act to consumers. Those are for your credit reporting agencies, and they're required to provide free monitoring for 5 years or more. So what type of information do we have in our business and that we should be worried about? And it not only includes names, addresses, social security numbers, driver's license, but also that information that we collect when we target our audience or our market, that biological data or analysis, that physical or behavioral human characteristic information that may be part of our subset of data. We have to make sure that there's no unauthorized access to any of that information. And we also must have notification provisions in place, as well as a written security plan. Now, this act took effect March 21st, 2020, during the pandemic. So this is a great session to be aware of so you can start implementing this program if you haven't done so already. Now, if your industry is under other types of legislation, for example, if you're an insurance agent and you're under the New York Department of Division of Financial Services, or a financial institution, a tax practitioner under the Gramm-Leach-Bliley Act, or a healthcare provider under the Health Insurance Portability and Accountability Act, known as HIPAA, you are exempted from this, but not exempted from the reporting. You're still going to be required to do all the things that we talk about today. And eventually it may end up getting reported if you're a New York company and dealing with New York residences to the New York State Attorney General's office. And they have the ability to impose injunctive relief and civil penalties of up to $5,000. So what type of information are we talking about here, or access that we're talking about that we need to be aware of? What we need to be aware of is it's broadening the definition of data breach to include an unauthorized person. And as such, you want to make sure you're aware of your staff. Like you know your customer, you have to know your staff. You can do background checks if permitted. But what you really want is the tone at the top, bring it down to the staff level, and let them be aware of the types of breaches that could affect your businesses and what type of information is confidential. Now, this written security plan should be tailored for your business. We don't have a lot of time in this session. Later on today at 4 o'clock, I'm doing an hour session, about 50 minutes on it. So we will actually have a template. But today I'm going to go over the New York State Attorney General's guide to business security. And why did they do this guide? Well, studies indicate that at least half of confirmed data breaches targeted small businesses, and as many as 60% of those businesses went out of business within 6 months. Important to do this, I would think. And despite that, only 50% of the businesses, medium and small, have secure company email, right? 90% of the cases are from spear phishing or phishing. So we're going to talk about later that you have to be careful with your email. No business is too small to be subject to an attack or too large. We're all on the same playing field. And without that data security plan, we're affecting our business, we're affecting our customers, and we're affecting small businesses and other businesses in our community. So what happens if I'm breached? Remember, in 2016, hackers breached half of all US small businesses, and over half of those attack companies go out of business within 6 months. It's very costly. Your reputation is affected. Your business could grind to a halt because you can't get access to your information. That's why in the accounting world today, possibly an asset will be your data. So you need to protect it. In addition, you will incur investigatory costs as well as legal counsel costs. Now, you may want to be considering cyber insurance, but that's something that you have to determine for your own budget. But if you did, you would have the insurance carrier that you would have to speak with as well. So you need to think about the budget. Now, public companies, it has been studied that they are spending about $3,500 per staff person. Well, we're small, closely held companies. We'll bring it down to a smaller scale, and maybe we'll put that into our budget. But this all depends on the size of your business. And a lot of this you could do just by implementing these internal controls. And there's 10 of them, according to the guide. And we always hear this. Use strong passwords and change them regularly, right? We want them to be complex. We don't want them to be 6 characters long, because they can then hit that password and open that password within 6 seconds. You want to have a long password, and you don't want to use something that's available on your social media, such as your pet's name. You want to use a password manager. And also, if you purchase, let's say, a piece of equipment that has a default password in it, such as a printer, you want to change that password because it can be all over the internet. Be aware that computer intruders use trial and error or brute force techniques to discover passwords, and it's happening all the time. You could read some reports at ftc.org with regards to that, ftc.gov, where you could find more facts about that. Install and maintain antivirus firewall programs. You want to up these, much like the flu virus and the coronavirus. A computer virus spreads from computer to computer, replicating itself and weakening the immune system of your computer. In addition, antivirus programs are able to scan the contents of the files you download, and you want to have firewalls on all your devices. Okay, firewalls are like a bouncer for your network. They scan the traffic coming into your computer and deny access to those potential threats. You don't want to use what is provided by your carrier. You want to use a commercial router, right? We want to have encryption, and we want our staff to be aware of the types of attacks that are out there. Internal control number 3, delete old files and accounts. That's what I said, strategic pruning earlier today. I brought that to the forefront. You want to empty recycle bins in your email, right? Hackers can't steal sensitive information if it's not there. So you want to have a retention policy, follow your retention policy. Limit access, again, to sensitive data. And we're talking about only on a need-to-know basis, not by an authorized person. And you want to break it into, I have a sales area or I have a payroll area. Those are the specific areas. The accounting area, they are all separated from each other so that not everyone has access to all the information. And remember, sending information over the internet could be very risky. In my practice, I use portals, and also we use protected emails to send that information. And most of the times don't like to send that information through email. In addition, a staff person could make a mistake. There was one instance where a junior accountant sent taxpayer information on a USB drive, and the envelope got there, but the USB drive didn't. That is a breach. And reporting it, we'll talk about later what you're supposed to do with regards to that. But if you offer access of information on your websites, your website must be secure as well, HTTPS secure. In addition, internal control number 5, be cautious with email attachments and downloads. Do not open the email, of course, if you do not recognize the sender, if there's gobbledygook on the subject, or if there's urgent requests, right? You want to check for spelling mistakes. Cyber criminals often use websites that resemble the names of well-known companies, but are slightly altered. For example, you might have a google.com, but with 3 O's, or a Microsoft without it. So you want to hover onto these. There was an instance where a client of mine told me their son got the lawyer's email got spoofed, and they were purchasing a property, and they requested the money, and that person did send the money, and it was lost. So you have to be very careful about responding to emails. You want to contact that company and make sure that that request is authentic. Internal control number 6, back up all files and software, right? We want to make sure that we're updating our systems, we're backing up. You could be backing up into the cloud, but you want to encrypt first when you back up into the cloud. Also, you want to have backup drives that could be taken off premises and protected so that you have access to them if there is a disaster or some type of event where exposure to your system occurs. Internal control number 7, establish network security access control. I'll give you a case study. In May of 2017, over 1 million Google Doc users were sent a fake invitation. They were phished to a document that looked like a legitimate invite, and then gave them access to the email. So you want to lock down your network, lock down your system, limit access to those devices, instruct employees to disconnect if they're not using the system, and of course log off when in activity, and watch for peer-to-peer access into the network. A lot of us are telecommuting these days, and we want to use a VPN, which is encrypted going into our systems. Consider multi-factor authentication as well for employees who log in remotely, and also use a secure wireless network. If you do have that, you want to make sure that you have 2 networks, a guest network and your network access. And these ranges for this wireless should be shortened, and also using a secure encryption, WPA2. Internal controls, step number 8, establish physical access controls for all computer equipment. So later on in my presentation, we talk about inventorying our equipment, inventorying our information. Who is using it, and what is on there, and what is it, the priority of that information if it did get accessed, high, medium, or low. And that's how we pinpoint where the weaknesses are in our system. Update your software, update your hardware every day, okay? If there is a patch that needs to be updated, you do that. There's a case study where the WannaCry ransomware attack was a worldwide cyber attack by the WannaCry ransomware crypto worm, which if you didn't install the patch, you were one of the 200,000 computers across 150 countries who was affected. And finally, internal control number 10, get the tech help when needed. You want to get that trusted professional. However, you want to vet them and make sure that they are part of the same security program that you are. You're going to enter into agreements with them. You're going to vet them, and they must be subject to the same security and confidentiality requirements as you are. So what happens when we are breached? Depending on the industry that you're in, the prior acts that I told you about, tax practitioners need to speak with their IRS stakeholder liaisons. Insurance agents or financial advisors need to go to the New York State Department of Financial Services, and they require reporting within 24 hours for IRS-related breaches. For New York State Department of Financial Services, 72 hours, and New York State Shield Act, the same thing. So what do? We contain the breach, take all affected computer equipment offline immediately, and then closely monitor all digital entry and exit points. So you're going to need a forensic consultant. But what I'm going to tell you is the forensic consultant should be hired by your attorney that you hire for this particular case, because then it's covered by privilege, all right? You don't want to use that forensic consultant that you've been using throughout your practices during your regular business operations. Investigate the breach, find out where the breach has occurred, where the entry has occurred into your system, because you need to identify and minimize the records that are affected. Remember not to destroy evidence in the course of your investigation, and it may be useful, of course, for law enforcement later. You will need to report this, but when you speak with the entity, and if you have a cyber insurance carrier, you're going to talk to them first, then your lawyer, and you're going to do the reporting to law enforcement. Sometimes they're not aware of it. I know here on Staten Island, the district attorney office has the Bureau of Economic Crimes Bureau, so they are very familiar with it. In addition, you have to do customer relations and public relations. So you may have to hire a public relations firm. And your lawyer will tell you that you will need to inform your consumers once we determine where the breach is. New York State Department of State has a sample letter, which I provided here in the PowerPoint and gladly will provide, where you could use as a sample to do your reporting to your customers. So let's rehash. The New York State SHIELD Act requires you to develop controls and procedures to address data privacy risk in your hardware and your email. And you should have a written security plan in place tailored to the size of your business, and you want to identify your security officer. Okay, right now, write down that person who would be responsible for helping you identify the weaknesses in your system. You're going to write your plan around that. You're going to test your plan. And New York State is currently releasing the New York Data Privacy Act. It's in the assembly right now. It's kind of stalled, but in there, it talks about de-identifying information. And the type of information that is non-public personal identifiable information. And it's defined as non-public personal information for financial information purposes. And you may say, well, I'm not a financial institution. You are if you provide credit to your clients. If you collect names and addresses, income, social security numbers, or other types of accounts receivable information, you then fall under this. And if you work with another company that is not an affiliated group and you're getting this NPI, you must limit the access to that NPI. And let me put it on a simple form. For example, telephone numbers are listed in a public telephone directory. An individual can elect to have an unlisted number, and that is considered NPI. You may have the number, then you must protect that information for that individual. So just to summarize, I want you to be aware what's coming down the road is the Federal Trade Commission requires us to have a privacy policy, a safeguards policy, disposal rules, and also they require, and it looks like they're going to be requiring, not yet, customer information to be encrypted both in transit, which is now, and at rest, which is coming in the future. Multi-factor authentication, tracking audit trails in your system to prevent a breach from occurring that you're not aware of, and requiring that financial institutions establish an incident response plan that we talked about within 24 to 72 hours, and safe disposal of information. So I list here, you could go to ftc.gov, take responsibility and assign an individual, assess the risks in your system, write the plan, test it, document your recommendations, document your implementation, and then God forbid there is a breach, you will have the information available so that you can show that negligence is not part of your business practice. And with that, Gina, I will open it up to questions.
Okay.
I could go further, but I'm trying to be cognizant of the time.
I see, Doreen, I don't know if you see the notes from Mike Bloomfield in here. If you want to look at those, they're under Q&A.
Let me see if I could, whoops. Let me get the PowerPoint back up. I'm not seeing, oh, Okay, it's on top.
Should say Q&A on the bottom.
Yes. If you'd like to share, they can also get signed up for a free cybersecurity training at their office at, can we forward this to them?
Sure. I think we can, I will see if I can copy this in, let me see if
Okay.
it'll let me do that. Or no, answer live. Let's see. Let's see. Nope, that didn't work. Where'd it
Well,
go?
actually, it's interesting that Mike did that, and that's great. I also provide in this PowerPoint the links to his online YouTubes on hacking demo, disaster, data disaster demo, and how to recover from ransomware. So he's a
Okay.
great resource.
Great. So for those of you who didn't hear, we do have Mike Bloomfield from Techie Geek, who's offering some free cybersecurity training at his office for free for those of you who are participating in the session. And he's also offering some assistance for people using Office 365, a free service there through December 15th, which is a secure email and portal service. So that's great. If anybody's interested in that, we can share his information on that front.
That also helps with the spear phishing and the phishing that we're talking about the emails. 91% of the incidences that come into your system are due to an email phishing. 60% come from insider and users. So that's why we have to make sure the tone at the top brings it down to protect the system.
That's great.
Yeah.
Okay. Anybody, do we have any questions for Doreen? I know this is all scary stuff and concerning because there are so many things change every day and the issues change rapidly.
Yeah, when I noticed, a lot of people think that they're not subject to it because they don't think they're a financial institution. And really, the way New York State is going to protect their residents is we're all subject to it if we're dealing with New York State consumers. So,
right, so this is important to nonprofits who might have members
Yep.
and memberships or any kind of constituency where they have their private data in-house.
Correct.
Okay.
And the more you document, the more you protect yourself from civil penalties, let's say. Or significant negligence for tax practitioners would be actually imprisonment.
Yeah.
But I don't see any practitioners on the line, so.
Right. Okay. I guess
All right.
we will, yeah, Doreen, I thank you so
Yes.
much for sharing all this information with the ladies on the call and the two gentlemen. I believe we have a couple of gentlemen who have snuck in. But thank you again. Thank you to everybody for participating. And again, Doreen Inserra, CPA.
And we have that session later on today at 4 o'clock. I actually go through the template on how to develop the plan.
So if anybody's interested, right, go through the Socio app and you can see the 4 o'clock session as well. Thank you all so much. And thank you for joining us. Thank you, Doreen.
Thank you. Take care and be well. Oops, let me get this in here. And let me log out.